All right, everyone. Thank you for joining us today on Facebook Live. As usual on Fridays, we have Dr. Millham joining us. Thank you.
Thanks for having me.
And I'm Ashton Day, health educator here. Before we get started, there are a couple housekeeping things, if you will, that we should go over. Just a reminder, our stay-at-home order was extended through the end of the day on May 3rd. We are planning on releasing some guidance next week on how to move forward. If you could, just so everyone knows, we are still working on that very diligently. We have a lot of people on that project, and so we're unable to talk about that today, but stay tuned for next week. We will definitely have that for you. And then Dr. Millham, so if you could just go ahead and give us a little recap of everything that's happened this week. I know it's been a lot.
It has been a lot. There's been a lot of information coming out. The Infectious Disease Society of America posted an update on treatment guidelines. Johns Hopkins came out with their recommendations about, and actually those guidelines also included analysis of the serology testing that is getting a lot of discussion right now. And then Johns Hopkins came out yesterday similarly discussing the serology testing and kind of just a number of things behind that, which I know we'll get into as part of today's discussions. Obviously, lots of discussions about how is the best and safest way to reopen communities and cities and states, and that's kind of going on nationally. I'm sure everyone is well aware. We are at 92 cases still here in Boone County. You can see all of those updated numbers on that website that we reference kind of each week, that como.gov/coronavirus. And so given that we're talking so much about the serology, I think that's going to be one of our kind of high points today. And I'm sure I'm missing other really major things that happened this week that we can bring up if we need to throughout this half hour.
Yeah, before we get into serology, I think it is important to note that there's a lot of talk going around right now about treatments or prevention for coronavirus. And if you could talk a little bit about why it's dangerous to do some of those chemical-based ideas that are around there.
Absolutely. So I think that it is safe to say that literally everyone wants there to be an effective and safe preventive strategy and treatment strategy for this coronavirus, for this COVID-19 illness. There is not a proven treatment currently. Specifically to talk about some things that have been discussed more recently, environmental cleaners, so things that you would use to clean objects should absolutely not be put in our bodies in any way, shape, or form. It is incredibly dangerous and can be fatal. So please do not do that and discourage others if they are considering it. So that would be kind of one really important piece. There's also a lot of talks about hydroxychloroquine and chloroquine type of medications. The evidence does not support using those for treatment. There are risks with ingesting those substances as well if it's not used appropriately and under really used under expert guidance. So you need a provider who is knowledgeable with those drugs before using them, but they don't appear very promising for this particular illness. It is not all doom and gloom. It is important for people to know that there are some ineffective and dangerous treatments that have been discussed. And so I want to lay that to rest first, but there are a lot of medicines that are being studied for treatment for this. And there are a lot of studies underway for vaccine as well. Usually we look at, it's usually at least 18 months for vaccine. We are fortunate in some ways because this virus is similar to, even though this is a novel virus, this is a new virus, it has kind of some cousins that existed prior to it. And so vaccine studies that have been done for other similar viruses can kind of give these scientists a bit of a head start. So maybe it won't be a full 18 months. I am certainly would it would not be wise of me to claim to give you an exact timeline. That 18 months is an estimation based on prior vaccine development. There are, again, some things that make us think it may not take that long, but that is something that we just kind of have to wait for the science to be there to support that from a preventive standpoint.
Yeah, I think it's really important for people to remember too. I mean, it feels like we've been dealing with COVID for years now, but it's really only been about 6 weeks, I want to say, at least locally, since our first case, I mean. So it's still very new. We're still learning things daily. I know it can be frustrating for a lot of people because it has changed our lifestyle, but we are still bringing you the most updated evidence-based information that we can, and we are basing all of our decisions at the local level off those evidence-based studies and findings. But then I know state and federally they're doing the same. So there is a method to our madness in a sense. Um,
Sure.
so getting into antibody, and I think you called it serology, is that the same thing?
So, well, serology testing includes antibody and antigen testing. Certainly, the antibody testing has the most. There's more literature out there about antibody testing. There's more antibody tests that are being discussed, but that serology kind of umbrella encompasses both of those types of testing. And so specifically the antibody testing has been discussed a lot for a number of reasons. And so again, we would really all love for there to be a test that is super accurate, or maybe even more accurate than the one we have now, really fast, and widely available, right? That is what we would like to have happen. And so I think a lot of folks understandably really want this antibody test to serve those purposes. It does not, and I'll explain why. It is a quicker test, but it is not as accurate for diagnosis as the current testing, which is molecular. It's also known as PCR-based testing. So it's just a different way to, trying to think about the best way to present this without kind of getting too in the weeds about it. So it's just a different way to test. And the test does take longer than some of these new rapid antibody tests. But the currently used PCR test is more accurate for diagnosis. So the antibody test may have some uses. At this point in time, it does not appear that it's going to be a good idea to use it for diagnosis of COVID-19. That's because, again, it's not as accurate as the currently used test for that, but it's also unclear as to what exactly a positive test, whenever it comes to an antibody test, means. So it takes a little bit longer for an antibody test to be positive than a PCR test. That's one of the kind of pitfalls of thinking about it for a diagnostic use. But the other thing is that we don't totally know what that means if you have antibodies to it. Yes, that means you've been exposed. It does not mean that you're immune. It may, but we are not, the science right now cannot prove to us that that is what that means. So I'm sure some people who have those antibodies probably are immune, at least for a transient period, for some period of time. We don't know how long that would provide immunity, and we don't know that having those antibodies actually means that you are immune to this particular virus. So that's a major limitation whenever we think about using it for diagnosis and for kind of treatment, kind of thinking about it on an individual level. Where it may be useful is for surveillance, and that's likely going to be the case, where we can see how many people have been exposed to the virus. So it is really promising. Again, I'm not just trying to shoot down great ideas. I really would love there to be a faster, cheaper, more accurate test that's just readily available. I mean, honestly, I can't imagine anyone who would not want that to happen or be the case right now. But this test, again, just isn't going to fulfill that particular role. So again, kind of to reiterate, the antibody test it will likely be useful for surveillance to know who has, how many people, how broadly has the virus spread, how many people have been exposed to it. But that antibody test will not tell you that if you're immune to the virus. And it's also unclear at this point in time how much crossover there could be, we call it cross reactivity, between other kind of cousin viruses. So other types of coronaviruses that were around prior to this particular one. They have some similar traits. That's why they're under that same coronavirus heading. And so it is unclear how possible or how likely it would be that having had a different coronavirus could make this test positive for you. So there's more data that is needed at this particular point in time. Did I answer kind of most of the questions that have come up about that?
I think so. Talking about data though and why that's important, if you want to touch on, what's happening locally at the university and Red Cross and what they're doing to get that data.
Absolutely. So that, we talked just a bit last week about if you have recovered from COVID-19 and would be interested in donating your plasma, for what they call that convalescent plasma that might be used for treatments. And that does look promising. And the link to apply to do that, I believe Ashton has posted on our Facebook page to contribute there, which would be really wonderful.
As more research is needed, what is kind of like the timeline for that to be expected for people in the general public and specifically for our area to have access to a test like that?
So that is hard to know today. I am a little reluctant to give a specific, because I don't have a specific date for it, and so it's a little hard to predict that. It seems like at least a few weeks, I would say at best. And the other thing is that as we look to get more data, that data isn't guaranteed to reflect well on the test. So I hope it does. I really hope that over the next few weeks, there's just tons of studies that come out that tell us this is going to be really helpful for surveillance. This is really accurate. There's really limited cross-reactivity. But if that's not what the studies show, we still have to listen to the data and to the science. And, I know Director Stephanie Browning on Monday had said we really have to continue to follow the data. We have our decisions as a community even really need to be data driven, science driven. And so we have to continue. So when we say we want more evidence, we love for that evidence to point to this being a wonderful thing to address this pandemic, but we have to be open-minded and just look at the data as it comes in to decide, does this make sense for our community? Is this beneficial to our community? Because right now, testing, even if we had access, for example, testing our whole community for the antibodies and then saying, okay, well, you've got those antibodies, and releasing that person back into the community saying, well, you've essentially got this bubble around you. You can't get reinfected. That's not the case as far as we can tell. We don't know that you can't get reinfected if you have those antibodies present. If it does, so if having those antibodies present, if that does mean that you're immune, how long does that last for? These are questions that really have to be answered before we would be able to even consider using the antibody testing for that type of purpose.
Yeah, I think there's a little bit of a misconception that once we have access to an antibody test or even to a vaccine, that coronavirus will kind of just go away. Can you explain why that's not necessarily true?
Yeah, so unfortunately, this virus is not going away. We will not be in the situation or the state that we're in right now in regards to this coronavirus long term, but the coronavirus is probably going to be with us long term, just not at this particular stage or this particular extent. So we've kind of talked about the limitations of the antibody testing. So we'll talk about the vaccine too. But again, I think kind of that's important in this particular light as well to reiterate that we do not know. And I keep using the word immune. I'm not sure that if everyone knows what that means, but that would mean that you are less likely to get that infection again. And so we don't know if having the antibodies means that. We don't know that after you've had this illness, that we don't know that you can't get reinfected. So time will tell us that, but for now, even those people need to be cautious. And so again, that antibody test would not be able to tell you that you can't get reinfected, meaning that that virus could recirculate, cause illness again. So then kind of switching gears to how the vaccine plays a role with this would be that vaccines, nothing is perfect. So vaccines are an incredible tool for public health. So by that, I mean for the wellness of our communities. Vaccines they save millions of lives. I mean, that's kind of like a whole topic on itself. It's so broad, it's kind of hard to even kind of think about how to get into it. So vaccines really decrease risk of getting an infection dramatically. But a lot of vaccines do not eliminate that risk of getting that infection. And so when we have a vaccine for this particular virus, that has the potential to make an incredible difference at decreasing people's risk of getting this illness, at decreasing the risk that it poses to our entire community or our country whenever that's available. So decreasing the burden, decreasing how many people would get the illness, and decreasing how serious that illness is when they get it. That will be huge. That will be such a great day when that is something that is being implemented. However, having a vaccine does not eradicate an illness immediately. And this would be a really great time for me to be able to give you like dates of when certain illnesses have been eradicated, how many years it takes after vaccine development. And I do not have those years on the top of my head, but some vaccines and some illnesses, it's not possible at this point in time to eradicate those. The influenza is a great example of this, that is a very smart virus that evolves and mutates and changes a little bit as time goes on. And so fortunately, we have scientists who track and try to predict those changes to try to formulate a vaccine that will address this kind of somewhat changed virus that has formed each year for influenza. And so this could be something more like influenza that we have to address on a recurrent basis. Time will tell us that. It's not entirely clear how this looks, at least from my knowledge. It does not appear entirely clear how this looks in the long run. Then there's other illnesses like polio. I really wish that, I should have those dates on the top of my head of how awful the burden of polio was in this country, and then the vaccine development and implementation, and then how many people do we know that have had polio? I mean, that is an awful, awful illness as well. And so it's hard to know exactly how this looks because whenever we look at the history of new illnesses and illnesses that we develop a vaccine for, we know that the vaccine will be beneficial. How dramatic that benefit is still to be determined. Does it completely eradicate that virus eventually? I don't have that answer right now.
Yeah, and I know I said that we as the health department are working on what that looks like locally in the meantime of waiting for tests and vaccines and all of that. But if you could provide some just generals as we work on specifics of generals of what people could expect to have to do, like, when it comes to social distancing and things like that.
Absolutely. So that's a really great point. So when we think of how life is now and how life was pre-COVID-19, it's gonna be a gradual process to get back to that. And it needs to be a gradual process because if we go back to living the way we were here in Boone County in January, COVID-19 could really create a new surge here, and kind of recreate all of our initial concerns that we had about, will we have the capacity to care for the people that need high level care. So it will be gradual. I'm going to reiterate kind of what Stephanie Browning, our director, talked about on Monday, as far as kind of the things that we have to look at. And these aren't just things that we look at to start the process of getting back to normal, kind of, so to speak. But these are things that we have to look at ongoingly. So if we get to return a little bit of normal life, and some of these 4 factors start changing and start becoming more concerning, then we may have to back up a little bit. So I know that it's pretty uniform whenever you look at everyone's guidance about what we want to see. Number one, it's that sustained reduction in cases for at least 2 weeks, since that's the incubation period for this particular virus. So that's one of 4, though. So, and then we need to make sure that our healthcare systems can safely take care of everyone that needs to be cared for. That's not only the staffing, but also the supplies and the hospital beds and the personal protective equipment. Number 3 would be testing capacity. And then number 4 is our public health systems of that contact tracing and investigation. And those four kind of broad categories that I know she talked about on Monday, those are things that we have to keep a close eye on going forward. And so we have to do a gradual kind of step towards normalcy, because if we start to see a increase in cases or depletion of supplies or room in our healthcare facilities, that would be concerning, and we need to be able to kind of dial it back again. I think that is probably the best analogy, and I should be giving someone credit for this, and I can't remember who said it, but it's not a light switch. It has to be a dial, and that dial has to be constantly reevaluated, so that if any of those 4 factors starts looking more concerning, it's got to be dialed back, and then hopefully we can dial forward again fairly quickly. Did that answer your question, Ashton?
Yeah, definitely. And you talked about Dr. Browning, her address at City Council Monday night. And in that, she also shared some estimations that we had prior to the stay-at-home order of what life could have looked like if we did not go under that order. Could you share some of that information?
Yeah, so I think this is like such an impressive number, to the point that I was like, are we sure we're talking about the right date? So based on those predictions, if the stay-at-home order, if social distancing, if those things weren't implemented, the predicted rate for Boone County alone would have been 189 cases at the end of March. That was almost a month ago. We're at 92 cases here. So you can imagine 189 at the end of March. We're going to post some graphs that would show what that would look like today, but it'd be a whole lot more than that. That sheer number of cases is not the most concerning piece of data there. It's that we know a certain number of those people would have died. A certain number of those people would have been really seriously ill. A whole lot more people would have been in isolation and quarantine. Those would have kind of been the lucky ones that weren't requiring being intubated in an ICU. And our healthcare capacity, we're in good shape right now, right? We've got 92 cases in Boone County, and we have 3 excellent hospitals here. 90, I need to have like the number in front of me, and I apologize that I don't, but we are going to post it. But you think about a massive number, all of those concerns that we talked about a couple weeks ago, the whole reason for the stay-at-home order and the social distancing, it's that it saves lives, and it has saved lives. And I think the graphs are just incredible to look at, to see that it's not just the number of cases, which is tremendous. It's the number of lives. It's our healthcare facilities, the people who work in the healthcare, their potential exposures, so many factors that really make me feel grateful that social distancing and stay-at-home orders were placed.
There has been some question of like how we know the social distancing regulations are why the estimated cases went down. Can you explain how that works?
Sorry, can you ask me that again? I didn't totally
Yeah.
understand.
So a little smoother here. How do we know the stay-at-home orders why we have a lower than estimated case count now?
There is really good science to back this up. And so trying to think of the best way to describe this. So I think, probably just that, if you look at communities that had a more significant impact and you see how it spread through those communities, and you see their particular, what we call doubling times, how quickly their case counts doubled. That's how you make that prediction. And so it's kind of like whenever you look at any type of scientific study where you're comparing, this is what happened because we implemented this. This is what happened in a very similar setting whenever this wasn't implemented. So that's your variable in this scientific evidence. And so when you look at, you can't just take two communities, but you can look at hundreds of communities and you can see this is what happens with this type of illness or with this illness specifically when these strategies weren't implemented. This is what happened when they were, and you can make that comparison. And so it's really similar to like whenever we think about is a treatment effective, right? We wouldn't compare someone getting treatment, someone getting placebo. We compare in thousands of people that are randomized. We figure out across the board how much of a difference did this one variable, this particular treatment make. So this is kind of similar. This is the variable is the stay-at-home orders. It's the social distancing. That's the variable that we can compare.
Yeah, okay. That helps a lot, I think, to fully explain it. I mean, obviously, we may never, since this is the path we went down in life, we may never know what exactly would have happened if we would have continued the other way, but there is evidence that shows we are on the right track and helping keep people safe during all this. I think that's all the questions we have for today, but was there anything else you'd like to share that you've learned this week or even some good news for us?
Yeah, so I mean, I think that is, I probably didn't put that in the right light. I mean, that is actually incredible news that we are at 92 cases and what could have been thousands of cases or what would have been thousands of cases. And so I feel like the way I'm presenting it is not making it really like that exciting, but it's so exciting. This is really, really great. And it's really important that we continue to keep pursuing the social distancing measures, even as regulations and orders are relaxed. Gradually, they will be relaxed gradually. Even as that happens, please stay smart with not touching face or mouth or nose, washing hands really diligently, keeping your 6 feet of space. Do not go out and expose people if you are feeling ill. Those things are going to make a huge difference to make sure that we don't let COVID-19 have a comeback here.
Awesome. Well, thank you so much for talking with us today. And we will have you on again, hopefully next week, and if not, very soon. Thank you everyone for joining us today, and you will see more from us next week.
Thank you.